Meanwhile, in India, the country has objected to a new World Health Organization report of people who have died as a result of COVID-19 pandemic. The report shows the country's toll nearly 10 times the reported figure.
India's government has rejected the WHO estimate released on Thursday. The WHO says that 4.7 million people died in India as a result of the pandemic until last year, when hospitals ran out of oxygen and beds due to a record wave driven by the Delta variant. India has reported 524,002 COVID-19 deaths, the most after the United States and Brazil, with more than 43 million infections. Actual infections are believed to be in the hundreds of millions in the country of 1.35 billion people. A senior health official said the Indian government rejected the WHO estimates as the numbers are based on modelling and assumptions.
Unfortunately, in spite of our emphatic writing, rational communication at the ministerial level, they have chosen to use the numbers that are based on modelling, assumptions. Modelling is, a one-size-fits-all kind of an assumption that you apply. You may apply that where the systems are poor, but to apply assumptions based on a subset of states, based on reports that come from the websites and media reports, and then you come out with an exorbitant number is not tenable. So that's on the process, and we are disappointed by what WHO has done.
In what has been the most comprehensive look at the true global toll of the pandemic so far, the UN body said on Thursday that there were 14.9 million excess deaths associated with COVID-19 by the end of 2021.
We speak now to Rajib Dasgupta, a professor of Community Health, Center of Social Medicine and Community Health, School of Social Sciences, Jawaharlal Nehru University. He speaks to us from New Delhi in India. Very good evening, or rather New Delhi, India. He joins us from Kolkata. A very good evening to you. Thank you so much for speaking to us. Let me hear your point of view first. Is it in tandem with what India is saying, that the World Health Organization is using an erroneous method, that of modeling, as opposed to the figures that have been released by India, the 2020 COVID-19 figures?
Hello, good evening. Yes, while WHO has been consulting all its member states as per usual procedure, the government of India has indeed, as also the report pointed out, objecting to on some of the key points. The WHO, on the other hand, also has a response to some of those key objections. We can take up some of those, but essentially what's consistent is that much across the South Asian countries, Pakistan, India, Bangladesh, the WHO report does indicate significant COVID excess mortality than was earlier thought. We also know that the excess mortality varies within the European region also, and therefore, and that's equally true of Africa as a region, where substantial excess mortality has been reported based on the computations of this model.
So, India has consistently been accused of underreporting on its figures. And can you please just share with me where the differences arise from? And as you've mentioned, I mean, just looking, it's a huge deal to say that they were 9.8 times higher than the official figures which India has released, and that is during the period 2020, January and December 2021, that India says the death toll is at 4,880,000, if I'm correct. 4 million rather, and 80,000. So tell us why there is such a huge difference in the accounting for those excess deaths, and perhaps in more layman's terms, so those of us who don't have the scientific knowledge could understand why there's such a huge disparity.
Well, first, the basic thing to understand is that this exercise tries to or seeks to compute excess deaths associated with the pandemic, which means that all of these are not directly COVID deaths, but any death occurring on account of the larger impact the pandemic has on the society, including its health services. And that's the first major point, that all of these are not COVID deaths. But in other words, had the pandemic not been there, this excess mortality would not have been observed. That really is the key purpose of this exercise, of computing any excess mortality associated with a major event. Second, the WHO estimates are consistent to the extent that it does reasonably match with several other such global exercises, and that's the WHO's claim in favor. However, India's objections are several fold. One, that India objects that it's been grouped as a tier 2 country, which means that and this is despite India's claim of having high quality data. Now, the WHO's response to that is that that data was not, the all-cause mortality data wasn't made available to the WHO, but only recently the 2020 civil registration data has been published just a few days back in India. But that's for 2020. Much of this excess mortality came in 2021, for which the civil registration system data in India is yet to be available. This is one example to give.
So the WHO, its mortality data, does it come directly from the Indian government, or as according to reports that in 17 states, much of this data was garnered from, I think, media reports and websites?
That's one objection that's been put forward. The response to that, again coming from another set of experts, is that what's been picked up from so-called media reports are reports by data journalists based on publicly available civil registration system data in a subset of states. In other words, put differently, that comes from the same government sources that produces the civil registration system. Now, these are the two opposing views. The fact is that there had been exercises going on based on wherever civil registration system data was available or in specific states, and they did show a certain degree of excess mortality. But the key point is that when you actually look at the WHO, the data that the WHO put out, whether by age or gender or by month, each of these figures has a lower estimate and a higher estimate and a mean estimate. Now, it is possible that now that the 2020 civil registration system data is available, that to be arguing in favor of the Indian government's argument, that some of these figures could actually be closer to the lower bound than the higher bound or the mean. That's certainly possible. And given that the 2020 data, civil registration system data, is now available, this can certainly be recomputed. And in fact, WHO in its statement has indeed said that they would certainly rerun the model based on the 2020 data that's now available. However, the bulk of India's excess mortality actually occurs in 2021 when the ferocious Delta waves struck across the country. Until that data is available from India, this modeling data would be a little hard to validate if this model is to be questioned or challenged.
And India says there's a one one-all-fits-all kind of approach by the WHO, and I just want to understand what are the peculiarities for India in terms of population size, land size as well. What makes it peculiar for you to object so strongly to how the WHO comes to this conclusion?
Yes, one of the key objections made by India is that it is a one-size-fit model, fit-all-fits-all model, but the WHO's argument has been that this is not a one-size-fits-all model because it takes specificities of countries such as income levels, reported COVID-19 death rates, test positivity rate, the stringency index of lockdowns, the morbidity patterns vis-a-vis non-communicable diseases. In other words, a wide range of parameters that are country-specific. And therefore, the WHO, in fact, in the FAQ that's released along with the report, actually underlines this point that this is not a one-size-fits-all approach. These are the two opposing viewpoints.
All right, so what is the effect of India being categorized as a tier 2 country?
Again, to go back to WHO's own explanation on the term of tiers. Now, the tier 1 or tier 2 country is not meant to be a reflection of a classification of its health systems or its data quality systems. It's only, this distinction is purely for the purpose of this exercise, where if complete and nationally representative monthly all-cause mortality data was available for this 2 years, then it's been classified as a tier 1 country. And if complete and nationally representative data, monthly data wasn't available, it's a tier 2 country. The WHO does clarify that it is not meant as a reflection of any general nature. It is very, very specific and limited to this exercise.
Right, so,
though this is one of the key objections that the government of India made.
So India says it has a very robust statutory system for counting. Can you just take us through it? Because often what we tend to do is when we have access to is the WHO dashboard of various international dashboards like Johns Hopkins to give us a sense of the figures, the mortality rate, and obviously active cases in a country. How does India's own statutory body compare to this?
Well, first to acknowledge that both the birth and death registration has significantly improved over years. At the same time, this does vary across states. Now, in the report that was released, the national report that was released a few days back, what it does show is that though increased deaths have been reported, which means that there's excess deaths, so about 500,000 deaths were recorded in 2020, excess deaths were reported in 2020, in contrast to about 180,000 official COVID deaths for that period. But that is also to be read and understood with a decline in 2.5% of the birth registrations. And this is as high as about 6 to 6.5% in states with very high degree of registration. Now, this essentially means that, like all systems, in any social service, any health service during the pandemic period, the civil registration system also underwent through shocks and strains, and that's exemplified by the lower registration of births. And therefore, the higher registration of the excess mortality has to be understood in the backdrop of this indicator, which is lower registration of births, which means that even in a strained system, the excess mortality is to the extent of nearly 500,000. And that, some experts argue, is a marker of the excess deaths that occurred. And I again repeat what I said earlier, that bulk of the excess deaths that the WHO computes actually came in 2021. And only after that civil registration system report is available could one convincingly argue this way or the other.